Thank you for the invitation to join today. And during the pandemic, it has been really encouraging to see the deepening partnerships of faith communities with WHO, UNICEF and other international agencies, but also between faith groups, including through Religions for Peace. I was stimulated and inspired by the discussion in the webinar last week, and I'm privileged today to add our perspectives from the Anglican Communion, supporting churches and agencies across the worldwide Anglican Communion churches with a COVID-19 response. And today we're discussing the role and impact of faith actors in overcoming barriers to COVID vaccination. The image of water in my slides is a reminder of what's often been said about the pandemic, that we're all in the same storm, but we're not in the same boat. The inequalities of global vaccine access are a scandal. At the end of May, it was reported that a person in a rich country has a 1 in 4 chance of being vaccinated, while a person in a poor country has the chance of 1 in 500. The Anglican Archbishop of South Africa, Thabo Makgoba, has said, "The poor are suffering from vaccine apartheid." Next slide, please. Earlier this week, I had 2 conversations with colleagues in sub-Saharan Africa, which exactly illustrate the barriers to COVID vaccinations. A bishop told me how his region had recently received 250,000 doses, but fake news had been circulating, so people were hesitant to come forward. But also the governance and the infrastructure were weak and unable to mobilize. And so 75% of these vaccines were thrown away. The next day, I spoke to a colleague in a country facing a devastating second wave of infections. Intensive work, including by faith leaders, has overcome people's concerns. So there are lengthy queues at the vaccine centres, but a lack of vaccines. Reportedly, just 20,000 doses left in the country at this time. So today I want to reflect briefly on our experience as the Anglican Alliance in seeking to overcome these 3 barriers: vaccine hesitancy, inequitable vaccine access, and structural issues. The challenges are indeed great, and we continue to share and learn from others. And we need each other to help make everyone safe across the world. Overcoming vaccine hesitancy. It was good to hear others talking on this issue in the last webinar. I won't therefore go into details, but just to say that listening to local contexts, research and shared learning has been crucial. Our global COVID task force has developed an online resource hub shown here, which includes information to answer genuine questions on vaccines and also challenge fake news. Like others, many of our clergy are vaccine champions using social media, and we have numerous churches serving as vaccine centres. I just want to highlight our latest initiative, which is to convene national conversations with church leaders where they can raise any questions or doubts about vaccines to help them as champions. It's crucial that these conversations are hosted by a trusted person who then facilitates the discussion between church leaders and a medical expert. And by focusing on the specific national context, these conversations are proving impactful. Turning to global vaccine equity, we're in constant touch with churches to map the situation at country level. We also took time to research and consult widely on a global policy position paper to guide and give substance to our advocacy asks. Through this, for example, we established that we should advocate not just for patent waivers, but also highlight the need for sharing technological know-how, vaccine recipes, materials, etc., to equip a massive upscale in production around the world. As faith actors, we also stress the moral imperative alongside the health and economic drivers. That vaccines are a global public good, not least in that many were developed with public funds. Speaking as global faith communities, we stand together committed to equity and urgency. Our Anglican leaders first issued a joint statement in November last year. Many also signed up to the People's Vaccine Alliance statement. And recently, the Archbishop of Canterbury issued a statement along with other global faith leaders and the leadership of ICRC, WHO, UNICEF, UNHCR, and others. Prior to the G7 summit, the Anglican churches also coordinated an advocacy initiative through their governments. And we're now working to analyse the G7 outcomes and maintain momentum. And finally, many Anglican churches have worked with other faiths to support national fundraising efforts for vaccines on the basis of get one, give one. For example, in England, the Archbishop of Canterbury convened a meeting with the chief rabbi and a senior Muslim leader, along with UNICEF UK, the government and the National Health Service, which led to the launch of the Give a World a Shot fundraising campaign. And thirdly, we need to consider how faith actors can assist in overcoming structural and systems barriers. Holding governments to account is crucial for vaccinations, but also for strengthening health systems in general. Faith leaders should ideally be represented at government planning tables, as we did with the HIV response. We can also further mobilise faith health systems and advocate that vaccines are distributed also via non-government channels. And finally, faith communities have a vital role in identifying those who are excluded and hard to reach, such as undocumented migrants and the homeless. And they're inspiring examples of faith centres providing vaccination on a welcoming and no questions asked basis, and also of outreach into vulnerable communities. There is a long way to go. And whenever I talk with churches around the world, they always highlight the value of solidarity, of connection and prayer, of travelling together through this pandemic. Sustaining hope is vital. The Anglican Alliance has an ongoing initiative of facilitating conversations around building hope together as we reimagine our world. We value sharing the journey with you all. Thank you.